Bolminaka. I want to start today with a reminder of what we are up against. It may have been some time since some of us have heard the latest statistics about the toll this virus has taken on humanity. They are shocking, so please listen well. 141 million cases of COVID-19 has been recorded worldwide. More than 3 million cases have lost, 3 million lives have been lost to this virus. And that's just by official counts, which likely far underestimates the actual numbers. In recent weeks, the virus has exploded around the world, often fueled by a more contagious variant, sending cases skyrocketing in places like India, Brazil, as well as in our own region in Papua New Guinea. This virus is as deadly as it has ever been before. It is more transmissible, and we must treat it more seriously than we ever have done before. As we all know, our contact tracing since the weekend has centered on the hotel staff who contracted the COVID-19 while working in a border quarantine facility. We have been concerned with her travel history, which placed her around Nandi and Lautoka while she was highly contagious. The most concerning part of her travel history was the funeral that she attended in Tavakumbu in Lautoka on Friday, the 16th of April, and Saturday, the 17th of April. The vast majority of the funeral attendees resided within the Lautoka and Nandi containment area. However, after our announcement yesterday, a family in Suva came forward to us to let us know that they attended the funeral. Thank God they did. As of this morning, one of these family members, a 40-year-old woman, has tested positive for COVID-19. This individual resides in Wainitarawau settlement in Cunningham. She lives at home with 6 others, her husband, and 5 children. She and all members of her household are all securely in isolation in Navua Hospital. Her family members have all tested negative for the virus so far. This case solidifies our concern that this funeral is the epicenter of an outbreak. We are treating it as a super spreader event. If you are at the funeral in Tavakumbu, either at the residence or at Pedaliama Church on Friday the 16th of April and Saturday 17th April, and the Ministry of Health has not yet contacted you, please call 158 right now. Your life and the lives of those you love may be at risk. Please pick up the phone and dial these 3 numbers, 158. I'm asking every Fijian watching today to help us spread that message far and wide. We are not a big country. We can find all these Fijians. In response to the case in Wainitarawau, when we were notified at about 10 p.m. last night, our teams have been activated and we started our containment program. We have established a screening zone in Wainitarawau settlement. The rules for the zone are simple. No one is allowed out. Those who live in this area are being allowed back in, but they must stay there. We are screening every Fijian in that zone and will keep that area contained for at least 14 days. The density of Fijians living within that settlement makes this area particularly high risk for the virus's spread. So we're not taking any chances. We've already established a containment area in the west. We have new health protection measures to announce today for all of Vitilevu. These measures will take effect from tomorrow, and they must be met with a measure of responsibility from every Fijian. For all of Viti Levu, high-risk businesses such as gyms, movie theaters, video gaming shops, cyber cafes, taverns, bars, billiard shops, and amusement arcades cannot open for at least the next 14 days. Restaurants must not open for in-person dining, but may offer delivery and takeaway services. The curfew hours will remain from 2300 hours to 0400 hours. Supermarkets and shops selling food, including open markets, can open so that people can buy food. Banks can open so that people can get money. Pharmacies can open so that people can get medicine. FNPF can open so that people can access funds. However, it is vital that vendors and businesses ensure strict physical distancing before opening their doors. Make sure customers are in queues that are well spaced out by 2 meters, and please manage crowding. All employers can allow their employees to work from home if they can. Other businesses and places of work can open. Though staff must have the Care Fiji downloaded on their phones. If someone does not have a smartphone, their contact tracing details must be recorded every day. Customer-facing businesses should limit customer capacity to 50%. Businesses that do not manage these risks with COVID-safe plans will be shut down. The virus is here. We cannot afford to turn a crowded market into the next center of an epicenter. Vendors and customers must ensure that everyone maintains a physical distance of 2 meters. Everyone should wear masks. If you cough or sneeze, do it into your elbow or in a disposable tissue. For good measure, report your symptoms to the nearest screening clinic as soon as you can. Non-work gatherings of any size cannot take place anywhere. That includes religious services, weddings, and other events. This gathering restriction applies nationwide. However, we will be allowing people to hold funeral services with up to 20 persons. The reason is simple. An unplanned death cannot be rescheduled. So we will allow funerals to happen at a small scale. In short, if you do not have an essential reason to leave your house, do not leave your house. Stay home. Keep your children at home. If you absolutely need to travel, wear a mask. And make sure you have the Care Fiji app switched on. If you've traveled for an emergency, for your employment, or to access an essential service, head home straight after. Some people may not have a mask at the moment. We will publish specific guidance on mask wearing on our Facebook page, including for making of homemade masks. There is no excuse not to do your part. Every time you leave the house, the virus may be traveling with you. If you aren't careful, you may be coming home with the virus. The best course of action is to stay home unless you have a life-sustaining reason to travel. But if you have to leave, please wear a mask. Outdoor exercise is allowed, but you should only interact with other members of your household and keep a 2-meter distance from all others. Team contact sports like rugby, basketball, and soccer cannot be played. These restrictions are stringent. But as long as we are all responsible, they will allow us some measure of normalcy in our lives. If we all follow these rules, we can go through our day-to-day lives as normally as possible under the circumstances, and essential services can remain accessible to everyone. You will be able to shop for food when you need to. You can buy medicine when you need to. You can buy toilet paper when you need to. Some of you probably still have the toilet paper left over from your last year's panic spree. I assure you it does not expire. The point is, we should all know by now that panic is a pointless exercise. When we detect a case, the ministry will act decisively to handle it. We transparently announce it to the public once we have the facts. We always have and we always will. I'm telling you this because if these measures are not followed, if we see massive crowds of maskless people milling around, then we will shut down entire towns and cities. We've done it before. We will not hesitate to do it again. We won't know for some time whether this is a new or more contagious variant of the virus, but we should act as if it is a contagious variant. As I said yesterday, we have to start treating everyone outside our household as if they are positive for the virus until it is proven otherwise. From midday tomorrow, we are suspending outbound inter-island passenger travel. Freight is allowed. Passenger travel is not allowed. This is outbound inter-island passenger travel from Viti Levu. Passengers can travel to Viti Levu, but no one on Viti Levu can leave until these measures have expired. We know that isn't convenient for everyone, but the scenario of containing this virus throughout our maritime region all at once should be avoided at all costs. We cannot be fighting multiple battles on multiple islands at the same time. Domestic travel flights off Viti Levu have also been suspended. As for international flights, we are suspending all passenger air travel into and out of Fiji for non-medical purposes. We need every room available in quarantine for Fijians at this time. My fellow Fijians, the family in Wainitaroa settlement were not the only ones to come forward after our announcement yesterday. 3 of the missing links in the hotel staff's travel history were the driver of the minibus she took on Friday the 16th of April from Lautoka, the driver of the minibus she took from Nandi to Lautoka on the morning of the 17th of April, and the driver of the grey taxi she took from the funeral to the minivan stand in Lautoka on April 17th. Last night we identified the drivers of both these minivans and the grey taxi. They all came forward after descriptions of their vehicles and the times of travel were announced yesterday. They came forward knowing that they may have contracted the virus, and they did so because they care about their health, the health of the people they love, and the health of their fellow Fijians. They have since been quarantined. They will be tested for COVID-19. I want to say how grateful we are that they came forward and that they were very honest with us. They all committed acts of patriotism, high responsibility, and of courage that could very well save a lot of lives. Let their example be the benchmark for the level of cooperation we need from the public. My teams are tried and tested. They will put every hour of work that is needed to keep the country safe. But we cannot defeat this virus alone. We have succeeded before because we embraced a whole-of-nation effort to snuff out the spread of the virus and flush it from our communities. One of the best ways everyone can help us is by being honest about where they have been, honest about how they're feeling. We're still looking for the driver and the passengers of a public minibus that transported the hotel staff and one other family member from Lotoka minibus stand at Karambula in Nandi at around 5 p.m. on Saturday, April 17th. We urge the public to help us identify this driver and the vehicle. Right now, the virus still has the advantage. If we stay complacent, we will stay behind the spread. So please, wear your masks, keep your physical distance of 2 meters, turn on your your Care Fiji app, stay home as much as possible. Do not go to people's homes for gatherings. Do not share takis or bilos. Use your God-given good sense to protect yourselves and your families. The police and our health officials cannot be everywhere enforcing these measures. It's up to each of you, the Fijian people, to make smart choices that keep this virus from spreading further. We will now take some questions from the media. However, before I do, I want to make some important points. We're still seeing media outlets bypassing our official sources, publishing stories without the proper context, sparking panic among the public. This sort of reckless reporting can set us back with the entire containment strategy. It puts lives in danger, drives people to make bad decisions with bad information. We hold these briefings every day to get people the best available information. And we wait until we have all the facts so that it can be communicated as clearly as possible to the public. We don't deal in rumors, we rely on facts, and the media must hold themselves to that same standard. We do not publish panic nonsense for the sake of likes on Facebook or clicks on your website. The nation needs you to do better. Fijians who are affected by this virus deserve better. They deserve to have their privacy protected. So when you come here to post questions for the sake of people's time and data, please do not ask us questions from anything that we've already covered. Some of you have been quite insistent on asking me questions that we've already answered. Next thing also, I want us to keep focused on the new information that we have and not on something that the public already know. Thank you. Nawaliu.